How's it going today, John?
Good. How are you doing?
Doing good. My name's Derek. I'm a student physical therapist working under Dr. Clausen today. He informed me that you've got some lateral ankle pain. You sprained your ankle the other day in a gopher hole or something? What's going on with that?
I stepped in a gopher hole and just rolled my ankle in, and it's not feeling great.
Lots of pain then right now?
Yeah, lots of pain, swelling and stuff.
Well, sorry to hear that, man. But luckily, the reason I'm in here is because Dr. Clausen wanted me to do some ultrasound on your ankle, which its main purpose and main indication is to have pain relief. So what I'm gonna do is I'm gonna use this this wand-looking thing, and I'm gonna be rubbing it on your ankle where you've got some inflammation and where you sprained it, and that should help with pain relief and promoting tissue healing and those kind of things. Those are kind of the indications for it.
Right.
That's going to require me to put my hands kind of on your feet and ankle and rub the wand in that area. Is that okay with you?
Oh yeah,
Awesome.
whatever you need to do. Yeah.
Cool, great, let's do it. So could I have you like kind of sitting up with your ankle kind of hanging off the edge of this side of the table, if that makes sense?
Yeah.
So you can kind of long sit if you can. While John's getting ready, some contraindications for this treatment could include like if he has like a pacemaker, that would include like treatment up on the shoulder or something like that. Malignancies, tumors, open wounds. In this specific case, I'm going to be doing non-thermal ultrasound, which is going to target the cells and have them get some cell movement going and fluid movement. I don't want to do thermal. That would be a contraindication in this case because his tissue is inflamed, his ankle's really swollen up, and I don't want to make that swelling worse. So that's why in this case I'm going to do non-thermal. So John, do you have any like histories with like an ankle replacement or any like tumors or malignancies, I guess anywhere in your body, but more specifically kind of in this lower leg area?
Not that I know of. I hope not.
I hope not. Yeah, I hope not too.
Yeah.
Do you happen to have a pacemaker?
I do have a pacemaker.
You do.
Yeah.
Okay.
Yeah, right up in here.
Up in this area.
Yeah.
Okay. Yeah. So that's something like obviously like as I'm doing the treatment, if you feel like your heart start to flutter or like you feel like something's going wrong up there, like let me know and we'll immediately stop. Because I'm treating your ankle, it shouldn't be an issue using ultrasound, but rather be safe than sorry with something like that. So thanks for letting me know that you have a pacemaker.
Yeah.
And so now that I know that, I will continue with treatment because I'm not treating the ultrasound up in his shoulder area where the pacemaker is. If that was the case, I would just not do treatment just to be safe. So perfect. So now to kind of introduce how this works, I'm gonna talk about some of the parameters on the machine. So the important thing with ultrasound is I'm not going to start the machine until I put the wand on his ankle. I don't want to like wreck the crystal inside. So, but since we're doing non-thermal, how it's going to work is I'm going to press this button right here that shows sound. So that's ultrasound option. Since we're going to be targeting some more superficial tissues in his ankle, we're going to do it at 3 megahertz. If I wanted to hit deeper tissues, I'd leave it at 1 megahertz. Because it's non-thermal, I don't want continuous. I don't want the sound waves going in continuously. I want them going in at 20% duty cycle, which means they'll be going in 20% of the time, and then 80% of the time it'll be on rest. And then, let's see. I believe that is it. So, intensity. So intensity will be 0.5. I don't want the intensity too high, especially because I'm targeting more superficial tissues. And to get the non-thermal effect, I want the intensity to be at 0.5, but I won't turn that up until the ultrasound wand is physically on his ankle. So we'll go ahead to that. And John, what I'm going to do is I'm going to put some of this ultrasound gel just directly on the head of this wand here. And use this other hand. And what the gel does is it kind of helps to prevent like air bubbles getting in the way so the sound waves go more directly into your tissues.
Cool.
So that's the purpose of the gel. It might be a little cold, which I apologize for, but I'm going to start just rubbing it kind of in this affected area.
Okay.
Another key thing with ultrasound is there's something called the ERA, the effective radiating area. Let me pull some of this down. And that area is 2 to 3 times bigger than the head of the wand. I want to stay kind of in a smaller area so the sound waves actually treat the structure we're targeting. So I would start rubbing him with the wand in this area of injury with the treatment. Now that I've got the wand placed on his ankle, I can turn up the intensity. So you come over here and I would turn it up to 0.5, press start. And normally we treat them for about 5 to 10 minutes, but in this case, because of the sake of the video, we're just going to treat for about 30. So while we're doing that, I would say John, how's that feel? Do you feel anything?
I mean, nothing too much. I can feel you moving the head of that thing around on my ankle, but nothing major.
No heat or anything, no spasming or twitching of muscles or anything.
Mm-hmm.
Good.
My heart feels good too.
Heart feels good.
Yeah, no
Good.
problems there.
Awesome. And that's a normal response. If he was feeling heat, I would double check that I made the right parameters and didn't leave it on continuous to do thermal, because that would not be good in his current state of healing. But since he's not feeling anything, that's pretty normal. So we've been going for 30 seconds, so I'd press stop on the machine before I would remove the wand, and now I'd clean off the wand with some paper towel, as well as John's ankle. So, John, did you said you didn't feel anything. Was that comfortable at least? Like, I wasn't poking you with the wand or anything like that, was I?
Yeah, no, it was fine.
Good. Now that I've got John cleaned off, I would report back to Dr. Clausen and we would continue with John's treatment. Thanks.